Hello, how's it going everybody? My name is Naren Selvaratnam and I am from Southern Institute of Education and Management. Bit of a long name, I know. So today I have come here to talk to you about the OET Speaking Test. For some individuals, this could be a nerve-wracking experience. I totally understand that. And however, if you do follow the techniques that I tell you today, you can definitely ace this exam. So for you to understand how exactly you will be graded on the OET exam, the first thing that you should do is take yourself through the OET marking criteria. Now the OET speaking test has a very specific marking rubric. I will take you through it now. And as you see, there are multiple areas that you have to work on to score well on this OET exam. Now, one of the first things that I have to tell you is when you speak, you got to make sure that whatever you say is comprehensive to the person in front of you. What this means is your pronunciation is extremely important. And the words that you use has to be stressed. There are certain syllables now. If you speak Tamil, if you speak Sinhala for that matter, certain words you might not give the required stress for some of the syllables in those words. So certain syllables, if you notice that you don't give too much of stress, which means if you don't sound, you got to be very mindful about this as well. So make sure the other person who is in front of you can understand what you are saying, and at the same time make sure you stress the syllables properly in every word. And also pronunciation is key. So pronunciation is something that you have to be very mindful. And when you do all of this, you got to make sure that you have intonation. Now what is intonation? Intonation means variations in your tone when you speak. Now, if you are a doctor and if you treat your patients, it's extremely important that you maintain some kind of a flow in your speech or some kind of a flow in your conversation. If your client or if your patient is in severe distress, you need to make sure that you calm down your patient. So for that, you might have to change your tone. There are certain instances where you have to give some motivation to your patient. So in those instances, you have to make sure that you give motivation. And just by speaking about certain positive things, it might not necessarily be translated as motivation, but you got to indicate that you are motivating your patient as well. So for that, you might have to do a little bit of intonation. So which means your tone has to vary a little. That is one of those things. And in addition to that, you need to demonstrate a wider variety of vocabulary, a good range of grammar, and at the same time, you need to make sure that you speak as naturally as possible. Now here right now I am presenting. This is not the natural way that I am speaking. So this might look as if I am doing some decent job in terms of presenting, because I am not very good at presenting as well. So if that's the case, you need to speak as natural as possible. So natural speakers, of course, they might hesitate a little bit every now and then, but you need to make sure that you have some continuation in your speech, which means you don't indicate any instances where you look for certain words or where you think about the grammar structure. So if you spend time thinking about this, then yes, it might look like that you are slightly hesitant in terms of speaking, but at the same time you don't have a wide range of vocabulary and also grammar. So because of this, it's important that you pace your speaking very well. If you can speak at a natural rate while also thinking of yourself in a usual work kind of a situation, you can definitely ace this exam. Now that's what we are going to do today. Now let's get to the scenario. I have constructed a very simple scenario of a psychiatrist assisting someone with OCD in a private clinic. Now, this is of course not a OET exam. I haven't taken this from a original OET test for that matter, but out of my experience helping other medical doctors in their OET exam, I have just constructed this, and I'm going to just show you how exactly it takes place. Let's get with the scenario. Hi, my name is Dr. Schwartz. I am the psychiatrist here at Vijona Health. How can I help you today?
Well, doctor, my name is John And I have been having some pretty confusing thoughts recently. I thought I should come and speak to you about this.
Can you tell me what kind of thoughts you have been having lately?
Well, I have been thinking quite a lot about my office. I recently went through a specific incident, and there was police inside our office. They were conducting an investigation. For some reason, I have been thinking about this a lot, and I think police will actually come to my apartment. I think they are just after me, and I am trying my best to avoid all of this.
Okay, it sounds like this thought has really bothered you. So, do you think this particular thought affects you and your day to day work?
Well, yes, I have been thinking about this a lot, and as a result, uh, it is very difficult for me to even concentrate on my job.
Okay, I understand. So, did you communicate this to anybody, maybe inside your family? Did you tell this scenario to your wife or to your parents? Did you do anything about this?
No, I didn't really do anything about this because I thought I should not tell this to anybody.
Okay, I understand. So, if you haven't told about this to anybody and seems like you are having some distress and you told that working is also difficult and it's very difficult for you to concentrate, so may I know what exactly you have done so far to maybe overcome this situation?
Well, I haven't done anything per se. I have been just thinking about this, and I'm thinking too much now. Now I feel really scared, and my body is already reacting. I feel like I'm having like a heart attack.
Okay, depending on what you just told me, it feels like that you have some form of anxiety. But I can't come to a definitive diagnosis just by talking to you about this, okay? And the other thing is, if you keep on thinking about this a lot, maybe you are having some obsessive thoughts. Now, obsessive thoughts could be a result of just normal anxiety. Sometimes we obsessively think when we have anxiety. But at the same time, this could be an indication of some other psychotic condition as well. But anyways, what I can do is I can actually take you through some psychological assessments. So if it is just anxiety, then it would be better to rule out other forms of psychotic symptoms as well. But if by any chance, let's say you have some psychotic symptoms, for example, obsessive thoughts could be delusional as well. If we are thinking too much about it and if we truly believe that those things could affect us. If that's the case, then I might probably prescribe you some medication. Now, this medication might have some side effects, but don't worry about it. What I can do is giving you some more information about this particular drug that I'm going to give you. It's an antipsychotic drug. But the good thing is it can actually stabilize you because right now you are having so much of distress and this distress can be very quickly eliminated by these drugs. And while we give this drug, I will also get you to attend our cognitive behavioral therapy sessions.
Doctor, what is cognitive behavioral therapy?
Well, cognitive behavioral therapy is a short-term goal-oriented psychotherapeutic approach. So it's pretty much, talking therapy. So sometimes the medication can make us feel calm, but still our thought process has not gone through major changes. So what this therapy would do is it will change your cognitive process by changing your behaviors as well. Sometimes there are certain behaviors that affects our lives very negatively. So what this approach or what this therapy would do is it will change your thinking and also improve your behavior. So once you are stable after taking these psychiatric drugs for some time, I will take you through CBT as well. So we have an in-house psychologist. He will take you through the CBT sessions and gradually you will notice some improvement in yourself. And once you find this improvement, we can slowly cut down on the medication and get you to continue the psychotherapeutic intervention. Okay, that's exactly what we can do. Is there anything else that you want to know about your condition?
So, doctor, is it okay if I just don't take medication and focus on psychotherapy?
Well, that depends upon how much of distress you are having right now. if you are under severe distress, just psychotherapy might not give 100% of results. So for that, I might have to stabilize you. Since I have to stabilize you, I might prescribe you some drugs. But before that, we have to do our assessment. Once we do the assessment, we can be 100% certain. Okay? So we'll do like this. So what I want you to do right now is just give me about 10-15 minutes. I will get my assistant to come and prepare the tests, and then I'll have a discussion with you, pretty much like an interview. So don't worry. This will help me to understand more about your condition. And once we have some definitive answer or definitive diagnosis about your condition, we can proceed from there, okay? So this is exactly the plan as of now, and we'll do like that. Now, what you saw was a scenario in OET test. Now, I know this is not the most correct form of OET speaking scenario. There are certain lapses and things like that as well. For example, I did collect some history from the patient. I did demonstrate certain skills of rapport building. I did demonstrate a few things about my understanding on the disorder. So I'm not a psychiatrist, so of course.
I mean, I technically should know about all of this since I'm a psychologist, but then again, I usually don't deal too much with medication, so that's why, in case if you notice some kind of hesitance in myself while talking about medication, that was the reason.
So see, these kind of day-to-day things could affect you as well. So you have to be very mindful about your overall approach for this exam. But overall, it has to be very simple, and you got to speak as naturally as possible. So if you are interested in practicing more like this with me and in our institute, all you got to do is contacting us today. So our phone number is 091 455 4551. If not, you have another number as well, that is 091 3133 888. So both of these numbers work. You can call us and you can schedule a time to come and have a discussion with us about your OET exam. Now, you don't need to follow a very strict structure. We are very flexible. Depending on the areas that you want to improve, we can slowly work on those. But for speaking, we'll be doing something like this. And I hope I'll be a good patient for you to practice your OET test, okay? So with that being said, that's it from me today. I'll see you again in the next week. So thank you very much.